they see the excitement and engagement that the students have for their learning, that all really helps contribute to the learning outcomes that you saw in that study. And we've now we have 16 different peer-reviewed published studies documenting all these benefits of this virtual learning environment. So I'm proud of the work we've done. I'm incredibly proud of the partnership we have with the California community colleges, and I'm confident that we'll see a huge boost in the interest and the opportunity in using these virtual learning environments in combination with physical as well.
Give me more details about how this partnership came into being, and specifically with California, in terms of their need, how you guys connected, and why that system really, in this timing, it seems like great timing.
I think we had already partnership with several of the colleges, and working really closely with several professors and teachers in the region. So we already had that interest. And when we started working closely with the system, we saw an incredible opportunity to collaborate together on serving the needs, because right now is an incredibly challenging time for teachers and students who are at home having exams, and they need the tools that so that they can continue their learning in these challenging times. And it was an obvious fit. It actually went incredibly fast. Within just a matter of weeks, we were able to roll out to more than 100 different colleges across California, train the teachers, which is also an important part of what we do. We really coach and support the teachers through the journey, and we have live support as well for the students. So really incredible partnership. It's really a win-win-win all around for everyone involved here, as I see it, and as we hear from the teachers and students as well. So yeah, incredible. And this, by the way, as you see here, is one of the examples of the teacher dashboards where the teachers, we like to say that give the teachers a little bit of a superpower as well, where they get now insights into how every student is performing in these virtual learning environments. And they can really see in their classroom where are the students struggling the most, so that when the professors have the follow-up lectures, they can really focus down on the areas that benefit their classroom the most. So there's so many great benefits for online learning, and we see now how teachers really are, of course, obviously forced to explore this more, but also then experiencing and seeing those benefits in using these tools.
I mean, I know when you first started talking about virtual labs too, one of the things that you talked about was someone could do it virtually because it was safer, and then go into an actual lab and do it for real and see it in a real space. For these students, a couple of things occur to me. That one, these labs that they are going into virtually are probably much nicer than any lab they've actually seen in person for the general cost of it. But virtually and the actual, real lab life, how different are they, or are these just supposed to give you this, kind of scorecard to kind of get people to the concepts and get people to, what we know to be true, or these are just actual experiments where we know the end game, and so we know we can really break down how they would change if someone did something in a different way?
I think so. So there's so much, in the virtual world, again, we can provide unlimited access. And I think that's really the key message here, that every student everywhere should have $1 million laboratories. If it's already there, we have it, it's available. And it's more about really working with the individual systems and colleges and professors to show them and train them in using these tools. And as we saw there earlier, we can do that incredibly fast, roll it out quickly, give the students this training opportunity. And then once we go back to the physical laboratories again in the future, the students are prepared. Just like a flight simulator, you want to have the pilots do most of their training first in the safe virtual environments. And then once you have all the practical skills, the concepts mastered, then you're ready to go into the physical environment. And I believe we'll see a lot more of that going forward. There's so many benefits, and cost is also another important factor in all of this. A lot of colleges and students across the country are very challenged also from a cost perspective now. And this is an opportunity where you can actually virtualize learning and not compromise the learning quality, and still give them the students the opportunity to maybe at the end of their training do the physical hands-on training.
So how expensive is it in this partnership for these colleges to tackle this and to take this on and to offer this for their students?
Yeah, so it can be as little as a few dollars, where we also offer to provide the training for the teachers and so a fraction at the cost of what a physical laboratory costs. And as a response to this COVID-19, we really realized that we as a company needed to step up and provide this access to as many teachers and students around the world. So we really provide this as heavy discounts, even below our own cost here at Labster. But we believe it's the right thing to do. This is about helping the students and the teachers at a time where they need it the most. And again, we're super proud about what we've been able to achieve, especially in this partnership with the California Community College System.
Yeah. Where does it go from here in terms of, the learning, the sharing, the technology, and how we really kind of reimagine education in general? I mean, I think we've had to do that just out of necessity. And obviously you've been reimagining how we could do it for a decade. And I'm sure you're like, keep up, everyone. I've been here for a while. But do you think it's going to change really, higher learning? Colleges in general right now, if we go into that college space, aren't sure that they can put a bunch of people in a classroom anyway, know? And so, as we look at how it's going to change, where do you see this going?
It will definitely change. Yeah, and we already see it. We obviously speak with a lot of chancellors and professors and institutional leaders, and it is already kind of in motion. Every of the partners we work with are already planning for longer term shifts. And it's interesting also in the education space, it's actually one of the industries that are the least digitized in terms of digital versus non-digital content spend. And we are already seeing an acceleration of this. So we believe there will be a huge boost and trend towards more online learning. It will never replace the physical fully, but we see a great opportunity for working with more of these technology providers and a collaboration between colleges, high schools, districts, working together to provide the best combination of digital and physical on-campus training is where I think we'll see, or we already see that big shift. So,
have you always loved science?
I do, yes. And I'm so, our mission again is to empower the next generation of scientists to change the world. And we started this company to inspire students to go out and solve challenging problems, such as curing COVID-19 or diseases like this. I think this is such a critical time for us as a nation, as a world, to inspire more students, give them the tools, the training they need to go out and help us solve all these challenging
do you think that was a challenge? I mean, the term science is cool was created to try to tell children specifically that science is cool, that you should like it, that you should want to be a part of it. And maybe there was a disconnect.
All right, folks, we are going to another live event here while we are waiting for the President of the United States at the White House doing a news conference. We're going back out to New York. This time it is the governor of New York.
We don't have a conceptual plan. We don't have an abstract plan because there is no conceptual plan. There is no abstract plan. You have to have a plan that is based on facts, based on specifics. This is not about politics. This is not about spin. This is not about emotion. There are no conspiracy theories at work here. We outlined a 12-step plan that is factual, that is based on numbers, based on data, and then it has a numerical circuit breaker that is not subject to personal emotion or desire, but just checks and monitors that infection rate that we just saw in Germany and is watching for those increases. And if there's an increase, circuit breaker stops the reopening at that point. Some of the specifics we're looking at: you must have 30% of your hospital beds available. We can't go back to where we were, where we overwhelmed the hospital system. We have to have a 30% buffer. We have to have 30% of ICU beds. We have to have that buffer before we start bumping up against total capacity. And we have to watch the hospitalization rate and the diagnostic testing rate, how many are positive, how many are negative, which we'll take on a continuous basis. You see that number start going up, worry. But it's all based on the data and the numbers. I'm sorry. And the rate of transmission, RT, rate of transmission, not road and track, Rate of transmission has to be 1.1 or less. We just said Germany is at 0.1. Because the 1.1, that is textbook outbreak. So watch the numbers and watch the transmission rate. And how do you do that? You do that with testing, right? And that's why everybody's talking about testing. The testing allows you to continually test, sample, how many people are positive, how many people are negative. You see the positives start to increase through your day-to-day testing. That is a pause sign. We were doing about 20,000 tests. We said we wanted to double that. We're now on average about 30,000 tests per day, which is a dramatic increase, not where we need to be, but a dramatic increase. Where we are now, you should know, is New York State is doing more than most countries are doing. So we have been very aggressive in testing, and we have made great progress, and New Yorkers should feel good about that, but we have more to do. On elective surgeries, we had canceled all elective surgeries so we could have increased capacity in the hospitals. When you cancel elective surgeries, hospitals feel a financial pinch because that's where they make their money, is on elective surgeries. So for areas that don't have a fear of a COVID surge, we're going to allow elective surgeries to begin. That's primarily in counties upstate. Again, counties where we're still worried about a surge in the COVID beds, we're not going to open it up to elective surgery until we know we're out of the woods on the COVID virus. And this is a list of counties that are eligible now for elective surgeries. I'll do an executive order on that today. We've been worried about frontline workers because they are the heroes who are out there every day so everybody else can stay home. Somebody asked me yesterday on a radio interview, well, you know, you're out there every day. Are you taking care of yourself? I'm out there every day. Forget me. I'll tell you who's out there every day. The nurses who are in the emergency room, the doctors who are in the emergency room, the police officer who is going into homes and apartments because there's a domestic disturbance. The EMTs, the fire department, the delivery worker who goes to 50 doors a day and gets paid. Those people are out there every day. So they're the ones who are really doing the work. Compared to them, what I do is de minimis. And they're doing it not because they get paid a lot of money, not because people say thank you, God bless you. They're doing it because it's their value and their honor and their pride and their dignity, and they show up. Even when it's hard, they show up. My hat is off to them. But I want to make sure that we do what we need to do to protect them, that they have the equipment, they have the PPE, they have our respect, they have our gratitude. And I also want to make sure we're testing so we get them the results of tests so they can be taking care of themselves. I also want to see if we have a significant problem in any of those frontline workforces. So we're doing testing. We started with the New York City Fire Department and New York City Police Department. What we found so far, Fire Department, which also has the EMTs, tested 17% positive, NYPD 10% positive, number much higher in the FDNY EMTs. We believe that's because the EMT number is driving it up, but we have to do more numbers and more research to determine that. Remember, the EMTs, they are the front line. They're the ones who are there assisting the person in the closest contact in many ways. FDNY also. But we want to find out exactly what's going on. They compare to a downstate average of the general population of about 18%. And again, we'll do further research, further surveys to look at it by race and gender also. We're also going to do the same thing with the transit workers, the people who drive the buses, the subways, who clean the buses and the subways. Without those buses and subways, the essential workers couldn't get to work. Why didn't we just close down subways and buses? Because you close down the subways and the buses in New York City. Don't expect the nurses and the doctors to be able to get to the hospital. Don't expect a delivery worker to be able to deliver food when you ring on your telephone. So we need that public transportation to transport the essential workers. But those frontline workers are at risk. So we're going to do additional testing for the transport workers. I also commented yesterday, the Daily News had pictures of things that are going on in the New York City subway system, where the cars were filthy, they were disgusting, homeless people were there with all their belongings, and it was not just the Daily News picture. It reflected what has been in the press and what people have been saying, which is the deterioration of the conditions in the subways. Some crimes are up in the subways, even though ridership is down 90%. I don't even know how mathematically that is possible. The trains are filled with homeless people, and you're not doing the homeless any favor. I've worked with the homeless all my life. To let homeless people stay on the trains in the middle of a global health pandemic with no masks, no protective equipment, you're not helping the homeless. Letting them endanger their own life and endanger the lives of others is not helping anyone. So I told the MTA yesterday, in 2 days, which means tomorrow, I want a full plan. How do we disinfect every train every night? Period. Any essential worker who shows up and gets on a train should know that that train was disinfected the night before. We want them to show up. We don't want them to stay home. We owe it to them to be able to say, the train you ride, the bus you ride, has been disinfected and is clean. Also, state and local funding from Washington is essential. This is now turning into a political brawl on state and local funding. More and more, some of the elected officials in Washington are saying they're against it. They're led by Senator Mitch McConnell, who leads the Senate, who makes it blatantly political. No blue state bailout. No blue state bailout. What is he trying to say? The states that have coronavirus are Democratic states. And he's a Republican, so he doesn't want to help the Democratic states. He went so far as to say, well, he'd be in favor of the states going bankrupt. First, states have never gone bankrupt. States can't go bankrupt. There are serious constitutional questions about whether or not a state can go bankrupt, declare bankruptcy. And you need a federal law that would allow the states to declare bankruptcy, even if you got around the constitutional question on bankruptcy. So if he believed that, if it wasn't just political rhetoric and personal vitriol, then pass a law that allows states to declare bankruptcy. He would have to do that. And I dare him to do that and get that bill signed by the president. So, but to make it partisan is what is most disturbing. And you can see they're now rallying the partisan troops. Senator Scott from Florida says we're supposed to bail them out. We versus them. We're supposed to bail them out. It's we and it's them. That's not right. Who is we and who is them? Who is we and who is them? Them, the people who had coronavirus. They are the ones who had the coronavirus. We, without the virus, are supposed to bail out those people who have the virus. What an ugly sentiment. First of all, on the facts, it's not even close to right. And why they would even want to go down this road when the facts damn everything they're saying. And there are still facts. I know it's hard to communicate facts in this environment. I know a lot of the filters don't communicate facts. They all communicate spin now. Everybody has their own spin. But there are still facts that are not political theater, right? New York State bails them out every year. They're not bailing us out. We bail them out every year. New York State pays $29 billion into that federal pot, $29 billion more every year that we never get back. Our state contribution into the federal pot, the United States of America pot, every year we put in $29 billion more than we take out. On the other hand, they take out every year $37 billion more than they pay to the federal government. Senator Mitch McConnell, you are bailing out New York when every year you take out more from the kitty, the federal pot, $37 billion more than you put in? Who is bailing out whom? Senator Scott, Florida? You're going to bail us out? You take out $30 billion more every year than you pay in. How dare they? How dare they when those are the facts? How long are you going to play the American people and assume they're stupid? They are not. And they can add. And they know facts. And I don't care what the news media tries to do to distort these facts. They are numbers. And they are facts. And they can't be distorted. And this is every year. And look, what this is really about, it's the Washington doublespeak. You look at the bills that they want to pass and who they want to help. They want to fund the hotels, the restaurants, the airlines, the big corporations. That's who they want to fund. Well, who do state and local governments fund? State and local governments fund police, firefighters, nurses, school teachers, food banks. That's who I want to fund. And that's what it means to fund a state and local government. And that's the choice that they're making. Everybody applauds the healthcare workers. Jets fly over in tribute to the healthcare workers. That's all nice. Saying thank you is nice. How about actually rewarding them and making their life easier? How about giving them hazard pay? How about helping with their child care? How about helping families who can't feed their kids right now? How about helping the police and helping the firefighters and all the people who are out there right now killing themselves to make life easier for us? That's what this is really about. They want to fund corporate America. That's who puts money in their pockets. And I say, let's fund working Americans. That's the choice. Bail out, us, them. No, it's just theater. It's just smoke and mirrors to avoid the American people seeing the reality, which is whose pocket they want to put money in versus whose pocket state and local governments want to fund. The reason it is so disturbing to me, I'm not surprised by anything in politics. I've seen the good, the bad, and the ugly for many, many years. I was in Washington for 8 years. I know what it's like. But if there was ever a time that one could reasonably believe you could put aside partisan politics, if there was ever going to be a moment where we could say, you know what, let's stop, just for one moment, the partisanship, the ugliness, the anger, the deception, Let's just stop for one moment. If there was going to be a one moment to hit the pause button, the moment would be now. You have human suffering. You have people dying. You can't stop the politics, even in this moment? Even in this moment, when people are dying all across the country, you still want to play your politics? That's what this is about. And that's why it is so disturbing on a fundamental level. Politics, I'm getting up and I'm reading that death toll number.